What's up, everybody? Today I want to talk to you about how we deal with athletes that have knee pain. Now, knee pain with athletes typically, as long as there wasn't a previous injury, if they've had an ACL tear or something like that, obviously that's going to be taken care of differently. But if an athlete, it's very common for younger athletes, probably like from 13 to like 16 years old. Sometimes later, if they're doing a lot of impact, they have a lot of running, jumping, say like a basketball player has a lot of impact underneath their kneecaps because of this, but a lot of people get Osgood-Schlatter's, or it could be tendinosis or tendinitis, but they have a lot of pain typically right underneath their kneecap. And what happens is they usually get a band and it goes over, and that helps relieve the pain. Because their bones are growing so fast, their tendons and muscles can't keep up with it. So their tendon over this kneecap is that tendon goes directly over this. That gets stretched, okay? And then when it's stretched and then it gets impact, it gets stretched even more. So then you start getting some pain, start having inflammation there. Now there's a few things that we like to do. The first one I think is probably the best one, because we have to increase their quad strength, especially their VMO, which is like this little muscle right here. And then you have to increase the strength and the integrity of the tendon itself to have less pain. And going forward of continuing to be more durable as well. Now we call it Poliquin Squats. Okay, what we're going to do is you're going to put your leg out in front like this. Okay, I'll show you from the side, it'll be a little bit easier. I'm going to sit my hips back, and then this knee is going to come forward. I want my knee to go over my toe. I'm going to try to balance, okay, up and down, push that knee up and down. Okay, and you can do these weighted, okay, but at the most part, or at the first part, even if on the rack is a little bit too high, we can put it on a plate. So it's not as high, so standing on a weight plate and going up and down. This will directly burn that tendon, and it'll hurt at first, so like their first, like say they do 20 reps, their first 10, they're like, man, this like really hurts. It feels like that's the pain I feel all the time. But then after that, they're getting blood to the area, and that usually helps and builds up that tendon strength pretty quickly. We usually do like 2 sets of like 20 reps. We have athletes do this that say come to us and have knee pain. We probably have them do that in their warm-up before they even start with us. We're like, hey, go do the Poliquin squats. The next one's a little bit more advanced. And this is going to put a lot of stress on that knee tendon, and this is going to hurt. But this is going to actually help them, again, develop that quad and tendon strength. Now, so they're going to put their heels up on the wall so their heels are elevated. They're going to keep their back on the wall, and they're going to push their knees over their toes as far as they can, and then we'll come back up, okay, lifting back up and down. Okay, so this puts a ton of stress on your quads, compared to like a squat where you're going to be like this. You're going to use more your hips, but if we go away, knees over your toes, you're using a lot of your quads, and you're giving that a huge stretch to that tendon. This requires a lot more strength, so this would be like an older athlete. The Poliquin squats can be for anybody. We usually start everybody with that. We have our adults do that as well, just knee integrity, but also too, if they're squatting a lot, you can get knee tendinitis just from, doing a lot with a tendon that's not that strong. Then when we do lunges with our athletes, we make sure that when they lunge forward, one, we do this for ankle mobility, but two, we want that knee going over, because one, when they're sprinting, okay, say they're pushing off, their knee is going to be over their toe. But also that helps build up this quad and then helps build up that tendon. They'll lunge, bring knee way over, and do that. Now, obviously we're going to focus on cleaning up form, stuff like that with, say squatting. If they're going to squat, and they're coming like way out, way back, and we're like, hey, we want to do that, but we can get a little bit more of your knees, build up your quads a little bit better. If they need to get coached up on squatting, but also we're going to take away impact. So that because that they have tendinitis, if they come down from a jump, so say we're going to like, up to a box, and we have them step off, land, and then jump, okay, that's a ton of impact on that knee, and that tendon is stretching it. That's only going to kind of irritate it more and more. So that's why we'll say, hey, we're not going to do that. We'll still jump, or we want you to squat down, jump up and land, So we can still get a jumping portion of it, but we're not worried about them coming down from jumps because they're probably going to go to practice and do that on their own. We're trying not to run them as much because of that, but we still will get them in running. We're just not going to crush them with volume. So that's kind of how we would handle that. That actually, the Poliquin squats, for the most part, like that kind of cleans things up pretty soon or pretty quickly. So they can start doing those and then get direct work right into that tendon, that quad, and that will help that tremendously. It's not going to like fix it overnight, but it pretty quickly compared to the other ones. That one's a little bit more advanced, but again, taking away impact, having them lunge correctly, for them is probably going to be the best way for them to get out of pain. So if you have any questions, please let me know.